Hello guys, welcome to Black's Finest, and I'll be taking you through some of the top inventions made by African youths in the year 2020. Compared to 2015, where there was a total of 7 inventions recognized internationally, 2020 was a year where we broke the boundaries and made over 20 mind-blowing inventions. In this video I'm gonna show you the top 8 inventions that turned eyes in the international market. We all know 2020 was a hectic year, especially in Africa, since most of our countries are third world. Many lost their jobs, their loved ones, families broke, crime rates went high, starvation increased. In some countries there was law enforcement brutality on the public. In addition to all that crisis, youth pregnancies went high all over. But all that's past us. Before we start, kindly subscribe to our channel and turn on notifications for more videos like this. In this video I have compiled for you some of the top inventions made last year to help fight the pandemic. Number 1. In Kenya, a 9-year-old devised an automatic hand washing machine from local available materials, wood to be precise. Not that highly advanced, but simple enough to prevent hand contact with the tap and soap bottle. This 9-year-old by the name Stephen Wamukoda from Bungoma County, Western Province, Kenya, devised this foot-operated washing machine to help curb the spread of COVID-19 in his community, as it reduces the need for people to use the communal tap when washing their hands. The 9-year-old on Nation TV said that he wishes to be an engineer in the future. Down to number 2. Kenya's own Lamborghini, as people call it. The vehicle, made by 2 youths from Taita Taveta County, Kenya, showed how possible it is to excel in simple ideas. Driven by a hunger to invent and fight idleness due to school closure, 20-year-old Nasser Kichinda built a car from scratch with his co-creator Ferdinand Mbashi. The Form 4 pupil explained that he was inspired to design the vehicle from watching movies. With no training in mechanics at all, they used local materials and a motorcycle engine and started building the car. Using the engine, it can go up to 50 miles an hour top speed. Many people reacted to this, some positively, others negatively. Next on the list are police robots on lockdown patrol. On the wee hours of the lockdown era, many countries used all their police force, including military, to keep people indoors. This resulted in issues best known to inhabitants of each country. In traffic, police were harassing grown men like little kids and beating them up while calling themselves Serikali, which means government. But some countries did not go through this. On April 3, 2020, in Tunisia's capital Tunis, the police deployed a robot to help keep the public indoors during lockdown hours. If it spotted anyone outside, it would approach him or her, obviously not weaponized or with ability to fight, but just to ask the individual why he or she was out. The individual would then have to show his ID or passport and other documents to the robot's camera. The robot, by the name P-Guard, manufactured by Innova Robotics in their unknown numbers, were more effective than imagined. The 4-wheeled P-Guard has a thermal imaging camera and lidar, light detection and ranging technology, which works like radar but uses light instead of radio waves. Tunisia's robotic medic. When the virus first struck the African nations in 2020, There was a lot of isolation and discrimination amongst those suspected, and that in turn affected them to the point that no one wanted to be close to them, neither talk to them. Everyone was so afraid of contracting the virus, even the healthcare workers. Published on the 2nd of May 2020, it was revealed to the rest of the world that Tunisia had deployed a medic robot that was used as a medium by the doctors to interact with the patients. This was to limit contact between the doctors and the patients, thus reducing the risks of contracting the virus. The tall, single-limbed machine is mounted on wheels and is capable of taking pulses and checking temperatures and blood oxygen levels. Furthermore, it has a screen mounted on top of it, enabling audio-visual communication between the patient and the doctor. It also enabled virtual visiting through a website where the patient's family and friends would reserve time to see the patient. The robot is remotely controlled into the patient's room to allow the video conversation. Still under robotics, another African country drew itself under the robotics map by deploying their own. In Rwanda, one of the major challenges was the rate of healthcare infections that erupted. There was a need of reducing the contact between them since there were cases of inadequate protection gear reported all over Africa. To minimize contact between them and confirmed cases, thus reducing the risks of infection amongst healthcare workers, robots were deployed. At Gatega and Kanyanya centers in Rwanda, visits by medical staff to patients went from 3 to 4 per day to only 2. Since the 2nd of May 2020, about the same time Tunisia deployed their robots. The 5 human-sized robots are programmed to perform temperature screening, take readings of vitals, deliver video messages and detect people not wearing masks, then instruct them to wear masks properly. On Tuesday, May 19 at the Kanyanya COVID-19 Treatment Center, the 5 robots were launched by the Ministry of Health. Given names at Kinyarwanda, the bots Akazuba, Ikarezi, Mwiza, Nabo, and Urumuri, the robots were the beginning of a new era in the health industry in fighting COVID-19. Urumuri was deployed at the Kigali International Airport. The robot had the capacity to screen 150 people per minute, and I repeat per minute, and report abnormalities to the officers on duty. If you compare with the manual method, then it would take about 20 to 30 minutes to screen 150 people. Since Rwanda reopened its international airport, they detained close to 80% of all the infected coming into the country, by this therefore reducing the rise in number of new infections. Number 6. The Respire 19 portable ventilator. We all know that the virus attacks the lungs, making it difficult to breathe. Those who succumbed to the virus died out of suffocation. They couldn't breathe. A ventilator takes over the body's breathing process when the lungs fail to do so. This gives the patient some extra time to fight the infection and recover. On the 20th of April 2020, there were 627 confirmed corona infections and 27 fatalities. During this time there were only 500 ventilators across its 36 states and federal capital enclave, making it really scary. That inadequacy led to the discovery of a level 220-year-old engineering student at the Ahmadu Bello University, Northern Nigeria, Usman Dalhatu. He, together with his partners, Dr. Yunusa Muhammad Garba of the Human Anatomy Department, Gombe State University, and Aliyu Hassan, a graduate of Mechatronics Engineering, named the machine Respire 19. In the video shown you can see him showing his invention before presenting it to the public. It doesn't look much, but that machine has helped save countless lives in Nigeria. Usman said that he wished to excel in his profession and would like to build 20 more ventilators. Number 7. Rona. I bet you are asking yourselves, what is Rona or who is Rona? Well, at some point we've all seen on the news some information that at some point is considered as fake. Like the instant where a leaked video showing people dumping dead bodies into the ocean claiming to be dead coronavirus patients. It actually raised concerns and panic all over, but it was discovered that it was fake. In fact, the video was shot in 2014 where the bodies of some migrants had washed up onshore following a shipwreck. Now back to Rona. Developed by an IT student, Brian Wambui, 21-year-old at Dedan Kimathi University in Kenya. Rona is a data analytics robot that can help clear any fact or detail that may be fabricated or confusing. The questions are manually typed in, a feature more user-friendly as believed by Wambui. Then the robot does its research and instantly gives a feedback showing if it's true or not. It is mostly based on coronavirus and users can perform self-tests and assess their risk of contracting the virus. Currently still restricted to Kenyan boundaries, Rona aims to be a social enterprise that provides globular risk assessment tools for real-time trend analysis for various diseases. Next on the list is an alternative soap.
Now, you're probably thinking that the alternative soap is a hand sanitizer, but not everyone can afford it. Same to soap bars. Following the water shortage in Madagascar and the rising number of infections at the same time, Marie Christina and her team came up with an alternative soap that did not require rinsing with water to help the more vulnerable. With the virus at hand, washing hands with soap and water became the #1 necessity. But at that time in many communities, getting drinking water was another problem at hand. Her creation helped many in her community and others too, so much that she was approached for collaboration with the Ministry of Sanitization and Water of Madagascar. The soap is made from edible oils collected from local eateries. A liter of oil can produce 20 bars of soap. It is said to be entirely safe since more harmful aspects of the chemicals are removed during production. It is then mixed with soda to produce a bar of soap. She intends to expand to the rest of Africa. Indeed, this product is revolutionizing since it changes the way people think about washing their hands and sanitizing. The question is, if the alternative soap is water efficient and edible, what is the future of the rest of the other soaps, since they require enough water and should not come in contact with surfaces like eyes or mouth? Well, think about it and drop a comment down below. All of the listed inventions portray the same thing: we all can do something. The virus did not only bring bad but also gave each and every one of us an opportunity. We had more time to ourselves that we never had. I mean, did you read that book that you never had time to read? Do that workout you saw took a lot of time you couldn't afford? Did we think of how to better ourselves not only financially but mentally and spiritually? How many of you did research on new fields to do new things that generated a handsome income? Or looked into that risky idea you once had at the back of your mind? Did you call that person you ignored for so long yet he or she was important? Or did you change the position of your TV like you planned months ago? Anything that you ever wanted to do but didn't? Of course, excluding traveling. But we all had the same amount of time but different responsibilities. For those who lost jobs, did you explore new grazing fields, new ideas that could make you your own boss, although that's the hardest thing to do? So guys, don't forget to subscribe, like, and share the channel. This is our first video, so spread the love to that person you think can do something big. If there are any comments, feel free to do so in the comments section, and we'll get back to you as soon as possible.